Good evening and welcome to the Minnesota Spokesman-Recorder's MSR Health Podcast. I'm James Stroud, James L. Stroud Jr., writer, photographer, and tonight, host again. And I have two wonderful guests. At least that's what they told me, that they were wonderful, and I believe them. And they've got the witnesses to prove it. So tonight we're going to talk to um, Dr. Chomilo, who is Dr. Nathan Chomilo, correct?
Correct.
Who is the Medicaid medical director and practicing physician, working with the Department of Health and Human Services as well, correct?
Correct.
And we have Reverend Melvin Miller,
Yes, sir.
who has been at Progressive Baptist Church as the senior pastor for the last 7 years, correct?
Correct.
And I'm not gonna pretend like I don't know him because his dad was my pastor at Pilgrim Baptist Church years ago.
Yes.
So, and I watched Melvin grow up, and he's he still told him one day he was gonna be taller than me, and that didn't take very long. So here he is, and here we are. So welcome, gentlemen, and looking forward to our conversation tonight because I hear that there's rumors that you guys have been very busy working to get the information out about Medicaid, Medicare, and trying to address health disparities in Minnesota. Am I right? Is
That's
that rumor
correct.
correct?
Absolutely correct. Yes, sir.
Right. That's who wants to start telling me all about it. Doc, can we start with you?
Absolutely. And thanks for having me, James. Um, so I work with the state as part of the leadership for the state's public health insurance, Medicaid. And I like to usually start off by, talking about the difference, right, between Medicaid and Medicare, because they sound pretty similar, but they're pretty different in how they show up in our lives and our family members' lives. So Medicare is the insurance that the federal government pays for, that everyone is entitled to if you're a citizen once you're 65 and older, right? So that's just based off of age. You're here, you get access to that. And so folks who sign up for Medicare, that's administered through the federal government. With rare exceptions, the state doesn't have a whole lot to say about that. But Medicaid, which is my area, that is our public health insurance that's financed both by the federal government and the state. And so the state has a lot of say in how that's administered. And that is based off of both income eligibility, and so how much money you or your family makes, as well as certain stages in life. And so the eligibility changes. For example, if you are pregnant, it changes if you are navigating a disability. And so you think about who's covered in Minnesota. When we look at how folks get health care across the board, most folks get health insurance from their employer, from their job. And then there's about 20% or so, our elders who get it from Medicare, and then about anywhere from 15 to 20% that get it from Medicaid. And that's just across the state. Right? But when you look at our communities along the lines of race, ethnicity, we see the impact is different. So we look at our Black and brown communities. Black Minnesotans, about 40% of Black Minnesotans get their healthcare coverage through Medicaid, through the state. When you look at different stages in life, that number is even higher. Excuse me. So our children, 60% of our Black children get their healthcare coverage through Medicaid, through the state. And about 80% of our mothers and our birthing persons get their coverage through the state. And so when you're talking about addressing disparities, Medicaid's got to be at the table. And we got to make sure folks know, what they get when they sign up for Medicaid. And we got to make sure folks stay covered and stay connected to their health insurance. And so that's where a lot of our work has been, and where we've looked to, Pastor Miller and others to kind of help get the word out and think about ways that we can help the work they're already doing to keep our communities healthy.
Okay, so I also heard that you did some creative things to try to reach out to people. Actually, you had a health fair at your church, correct?
Absolutely. Thank you, thanks again for having us tonight. As a pastor, I'm a president of the St. Paul Black Ministerial Alliance, and we're a network of 13 churches or so, and I'm also in the State Baptist Convention. And we notice a lot of significant challenges in the African American community as we are in the throes of caring for people who are really struggling, our parishioners. And we see the disparities front and center. And so we've been working together. Our church in particular, we have a number of initiatives. We're actually working with the University of Minnesota and establishing a health clinic in our rec center that we're building. But this has been an amazing relationship working with DHS. We had a health fair, and we invited the community in, and of course our members and the members of network churches, and it was a very successful event. The challenge is that many individuals in our community are not taking advantage of Medicaid opportunity. There are a variety of reasons as to why people are not. And we are here to make the clarion call that, hey, we need to get primary care. We need to engage with primary care. We need to engage with Medicaid. And we want you to do it through the local church setting. A safe place, a place where many folks in the community are comfortable coming. We're one of the largest food shelves on the east side of St. Paul. And so we have a lot of people in and out of the building, and that's the case with a number of our other churches. And we're here to just open our doors and make the message clear.
Are some of your parishioners saying that some of the applications or some of the process to start the process is not user friendly, or folks are just intimidated by the process? What has been the feedback?
It's a variety of things, but certainly that's part of it. Cumbersome process, or at least they feel as if it's a cumbersome process. They don't feel as if it's accessible. And this is why the local church provides an amazing opportunity. The partnership is amazing because we're in the community and we're a safe place, and individuals feel comfortable coming into that setting. And so we've had some success in getting folks signed up in this partnership with DHS, and really excited about it. Really look forward to in signing up a lot more individuals and getting involved.
A lot of times people don't understand that community, what you're talking about is hand holding. I mean, figuratively, because that goes a long way. There was something I learned in 97, 98, while working with there's a community, local community lender, and they had money for local business and would-be business owners. And there was a statistic that came out nationwide through the SBA, and so you can have money earmarked for people who are different backgrounds. They say Hmong, African American, but if they show up and they don't see anybody that looks like them,
yeah, it's an obstacle.
And I use that example because we're talking about money. If you're talking about money and people still uncomfortable about showing up because they don't see anybody that looks like them on the other side of the table to help them with the process of applying for the money, some of the people are telling themselves, oh, I probably won't get it. But it's good to have that representation wherever you go. And also that hand-holding is important when you're talking about folks who just need to know that it's a safe space.
Yes.
So
yeah, and I mean, I think there's a lot of evidence that our systems haven't been safe, whether it's the healthcare system, whether it's our state government, and how folks have been treated, right? And you're talking about money. Like you look at these applications. I've when I got the job, one of the things I did was try to sign up and see what it takes for our members to sign up, and it's not easy, and they're asking you a lot of questions about your money, right? And so then you have to be able to trust the people, that this information you're sending in is you're sharing that with the expectation that it's going to be of value back to you and to your family, right? And so I think there's a lot of reasons why it makes sense for folks to come in with a little trepidation. And then I think the other thing is, when the pandemic hit, we passed policies to say that people didn't have to go through this. If you were already on our rolls in March of 2020, for 3 years, we didn't ask any of this information. We just kept you enrolled. And so then we're coming back and saying, well, now we're going back to the way it used to be. That was Congress's decision. No one in Minnesota's, but Congress's decision. And so, people might have forgotten what it's like to get through it, and all the things that you need to bring, and what that feels like. And so I think having, and what we learned during COVID was the importance of the messenger, right? Even as a physician, I'm not always the best messenger to be showing up into a room and talking to folks about their needs because of that history of how folks have been treated in healthcare settings and by other doctors. And so, being able to break it down and say, hey, if you get through this, this can help so that you can get your kid the shot so they can go to school, so that, you've had that pain in your shoulder for, a while. Why don't we get that checked out? Why don't we get you the screenings for cancer so that we, catch anything early and keep you healthy and around as long as possible. And so I think really that messenger matters, and which is why we're really happy to be working with Pastor Miller and so many others.
So, what are some of the other outreach strategies you have that were rolled out besides the health fair?
Yeah, and so besides the health fair, we've been working. We worked with TPT, local public television, to create ads that you might have seen running on TPT or on in between your YouTube videos that are talking about re-enrollment. And we're really, again, trying to build off what we learned during COVID-19 when we were trying to get information about keeping yourself and your community healthy. That the messenger mattered. We worked with over a dozen different folks from different communities within Minnesota to help record and deliver that message. And we looked at our data. We looked at where folks were likely to be coming up on this process, because the tricky thing about it is a month by month process. And so it depends on what month you originally signed up when you're due for it again. So you might learn about it, today, October, but you're actually not due to go through the process until March, right? And so, having the awareness is one thing, but having the awareness at the right time and then knowing where to go when it's your time to go through the process, or it's your child's time, or you're trying to help a parent go through it, that matters. And so having kind of the ads targeted to areas where we know there's a lot of folks that are due to go through the process has been one of our strategies. In addition to showing up to health fairs, trying to show up to community events more broadly. And so going to things like open streets and going to things like other cultural events around the Twin Cities, around the state, and instead of saying, hey, come to us, we got some information for you, let's go to where we know you'll be, have folks passing out that information. We worked with PICA Head Start, so trying to really work with parents and young families and meet them where they're at as well. And so it's been really great to see us be able to do things differently, and that this was made possible in part by funding that was set specifically for this campaign over the last year, that the legislature put aside. The Governor Walz signed into the bill, and so we're just hoping to kind of keep that momentum going, right? And understand that we want to keep folks connected and keep folks these relationships, so that not only we just connect them to health, but then once they're connected to their insurance, that we help them achieve health by making sure we're there to answer questions, that we continue to work with our communities to meet you where you're at.
Yeah. What's being done to? Are there any conversations at any level about trying to make it more friendly or simplify some things? Because I mean, I was an insurance agent, insurance broker, and I sat in the room. I was ashamed to say that I didn't really understand a lot of what was going on there, and come to find out, a couple of the other agents sitting around the table were the same way, and we've all somehow it all came out. And it was like, man, is that? And it was somewhat, we all sort of were relieved that we weren't the Lone Ranger on that, and it's not it's more than a notion to get through that process. So what are they doing?
Listen, I'm a whole doctor, and I can tell you that I've learned so much in the last 5 years in this role about our insurance system. I know that there's many doctors out there who wouldn't really be able to break down what it's like, what's the difference in which plan you're signing up for, the deductibles, the copays, all that stuff. And so yeah, our system is complicated, and what you're landing on is absolutely what I've heard ever since coming into this role. One of the things I embarked on in 2021 was a kind of year-long listening tour, specifically focused on U.S.-born Black Minnesotans, because you look at our data, not only is Medicaid providing the healthcare coverage for a lot of us, but we experience some of the higher disparities, amongst our members. And so, in the case I've been making is, when we think about what changes we should make, we should be listening to the communities who are most impacted, right? And one of the top things that came up was the process of enrollment and how can we improve that.
Wow.
And so we did put forth in a report in 2022 some recommendations to improve it, included some of this funding and working more directly with community organizations and community navigators that we've been talking about.
Navigators, that's the key.
Yes.
Yeah.
And then the others was, but that's, the way I kind of describe that to others is, well, that's us, paying people to help navigate a racist system. Can we take the racism out of the system instead of just navigate the broken system as it is? And so part of that is, can we extend our periods of eligibility so we don't have to go through this process every year, right? And so we put forth recommendations to starting with our children, because if you recall, 60% of our kids being covered. It's even higher if you look at young kids, close to 80% of kids under 5. And so we put forth a recommendation to have continuous coverage for children for the first 6 years of life. And that was put into law and signed in 2023. And we're waiting federal approval, but we anticipate that hopefully in the next couple of weeks. But that will be a big, step in the process towards you to say, to get rid of these barriers and saying, if your child, if they're born onto Medicaid, or if at any point in that first 6 years of life they qualify, you don't have to go through that process for them again until they're 6. And I hope that's a starting place. I hope and we also talked about for everyone else, doing it for 24 months or for 2 years. That yet hasn't been picked up, but that's certainly something that we still, strongly are advocating for. Other states across the country have done that as well. And then lastly, I'll say one thing that we think helped a lot here is kind of the automatic process. Like a lot of this data that we ask for to verify if you're eligible for state health insurance, the state probably already has it, particularly if you're getting any other state benefits, right? And so we have looked to, from behind the scenes, if we can improve our processes, and we did do that. We moved from kind of what we call an auto renewal rate of roughly 17% this time last year to this time now we're closer to like 60% auto renewal rate. So that means instead of getting that application to fill out, you get a letter saying you've been renewed based off the information we have. Just verify if there's any changes, let us know. But if everything looks good, you don't need to resubmit.
Awesome. One of the things that we've been really trying to integrate the conversation about Medicaid into most of the programming that we do. And it's really, really important. We're asking that other like nonprofit organizations to do the same thing. So backpack giveaway on the east side of St. Paul, 500 or so kids and their families came out. That was part of the conversation. Then we had my brother Steve Wilson come out. We have one of the largest Black college tours in the state. We take about 100 kids every year. We had 700 or 800 people in our sanctuary. The mayor was there, and that was a part of the conversation, over the course of the 9 months that we were working with those kids. So it's really about integrating the conversation about health and primary care weaving it into every aspect of what you do. It's really, really critical. I mean, it is a matter of quality of life and prolonging life, and it is a significant, very, very important issue. So often it's sidelined. It's not really something we talk about on a regular basis. I talk about it from the pulpit. I put a little Facebook piece on there about my own beginning to work out, right? So it needs to be a part of what we integrate into our conversation, all of our conversations.
One thing that I know that you both probably have heard is when it comes to, you say, focusing on the Black community, and someone says, you name the subject, The question is, um, do we have more people who care about folks more than they care about themselves in some cases? Have you ever heard that as it relates to um, things that are available, things that are, I mean, there are people who know and understand
Yeah.
some things and they're not following up, like screening for men,
Yeah. Yeah.
for prostate
Mhm.
and that whole thing. And so my question to you, um, uh, I've been interested in knowing what any faith leaders are doing in with a large, predominantly black congregation
Yeah.
as it relates to diet
Yeah.
and some of those conversations, because you look at some of the funerals and you look at
Yeah.
some of the bake sales, and
Mhm.
you know they can talk about all the stuff that's available at the health fair and sign up for health fair,
Yeah.
but they've got a whole table full of stuff ready to
Sweet potato
get
pie.
some diabetes specials and
Yeah.
on the plate.
Yeah.
And so, what are we doing at
Yeah.
your church and
Yeah.
some of the other faith groups about diet and consumption?
We had a health fair. It was a different one, and we brought in the University of Minnesota, and there was a dietitian there. There were some primary care folks, and we actually had a significant conversation. Actually, it was an altar program. We have a program in conjunction with Vanderbilt University and University of Minnesota. It's on dementia. It's a program that deals with dementia in the Black community, and we have this new ongoing conversation about how to make your greens without the fat meat in it, how to do it with no meat or some turkey or what have you. So we're having those conversations. How do you shift it to be a healthier option, or healthier options? How do you make your chicken and that kind of thing? So you're right. I mean, you can easily self-sabotage. You can be a part of a conversation about being healthier and not really actually in practice do anything different. So we're working on that, but it's very important. To another point you made, and I won't be long,
Take time.
we're addressing the issue of hopelessness. I was a teacher for 13 years.
I'm a teacher now. So.
All right, all right.
Yeah.
And
St. Paul.
oh, excellent, excellent. And so you understand what I'm talking about. There was one of the teachers in the high school I taught at said, there's a group of individuals who are the permanently unemployable, talking about individuals getting out of prison. It was just a weird conversation, but that is a mentality that a lot of people have. There are a lot of barriers. There are individuals who are struggling with barriers, just getting housing. I work with people every day with those kinds of challenges. And some people just want to give up. So what I care about healthcare, I mean, I'm dying inwardly anyway, every day. And so it really is about the social determinants of health in general. It's not just about healthcare and diet. It's how can you get this man a job?
Or how can you get them to keep the spirits up to even want to look for one, like you're saying?
Right.
Because it's just like, as a teacher, you can relate about classroom management.
Yeah.
If you can't manage the classroom, you're not going to be able to get to your lesson plan.
Right.
So you got to contain that first,
Yeah.
and then get their focus, and then you can deliver. So same for someone who is beating themselves up or counting themselves out, looking through the neighborhood, watching anything from development to health fairs and saying, look at what they doing, as if they don't belong in the neighborhood.
Right.
So you're right. We have to help them to
Feel like they're
keep hopeful.
Yeah.
You know.
Yeah.
And part of it is to your kind of earlier reflection too. It is a bit of that kind of what we hear when we get on the plane. Put the oxygen mask on yourself first before putting on others, and sometimes it is easier to kind of like look at all other folks struggles, help them fix those before turning inward, and then even harder if you don't. Again, as you're saying, see a future. And I think one thing that we are recognizing more in healthcare is those social determinants of health, right? And so if you're not connected to the healthcare system, that's actually been an opportunity more and more for some of your other needs to get identified, like your housing or nutrition, or even things like economic supports. When we talk about young parents and families, parenting supports, and early education, early literacy supports, these are all more and more being recognized as important to health. And so being in a part of your kind of benefit when you go to see the doctor. And so kind of helping folks understand the connection there, and that we're continuing to evolve, and that, you know, getting access to the doctor isn't just about getting that checkup or getting that shot, but that there can be a lot more help offered there too.
Dr. Chomilo, you're also wearing the hat as a researcher, right? So have you run across anything as it relates to the statistics about smokers and the I don't want to say, what I'm thinking in mind is for my question. This one just came off the top of my head,
Sure.
which is there are poor people who can't even afford cigarettes. But I'm wondering, are they the high end of people who are smokers? Is it poor people? Or is it folks who can afford them? I mean, did somebody do the research on that, or is there some data?
That's a good question. I'm not aware of kind of data that looks at, you know, currently the, you know, demographic breakdown of smokers by income. I do know, you know, one thing that the tobacco and nicotine industries have really been focused on is our youth, and trying to get them, you know, connected early, right? And you know, when cigarettes got kind of discovered for what they are, you know, they moved to other methods.
And that's why they got rid of Joe Camel.
Right, yeah, I remember Joe Campbell. He was
like that.
Yeah, he looked cool, but you know, where's he now? Probably.
And when I was coming up, folks would always, you know, when I was younger. Now I'm 66 now, so I grew up on black and white TV, and then we could go down to the local store right by the creek where the big boys would drink their Coca-Cola and throw it in the creek. We would wash them off and go get 2 cents for the little bottle and 5 cents for the big bottle. But that was a time when they allowed me to go to the store to get cigarettes for my mother.
Yeah.
It wasn't an age thing where you just go and sometimes we would detour and say we're going to get them for our parents. I don't smoke now. I'm just saying that as kids, a lot of kids experimented with the cigarettes.
Right, and then, you know, and cigarettes thankfully are starting to lose some favor, but we do see kids getting exposed to things like vaping, right, and the liquid nicotine. That in fact, from a kind of a biological standpoint, it's more addicting to the developing brain than cigarettes. And so we've been trying to raise the alarm, and thankfully there's been some moves to go after the Juuls and others of that are making those products, that are putting them in different colorful flavors and trying to target kids. And then I think, you know, the other thing that we have to keep our eye on too is with the legalization of marijuana, right? You know, like I think from a criminal standpoint, a lot of good things long term when we talk about the social determinants of health, right? But I think when we think about the developing brain, that's the other thing, you know, to kind of think about, and how that kind of leads into, you know, is there other reasons? Are we smoking cigarettes? Are we smoking anything? Are we drinking anything to kind of heal pain, heal trauma, heal all the things that we're dealing with, and where is the place as part of the community that we can help our youth navigate that?
Yeah, because this is beautiful. I was going to say the same thing after you made your comments. You know, we have, as a network of pastors, we have buried countless youth in the 20s and 30s from heroin overdose and various really strong drugs, and that is a crisis across the country. And so this kind of escapism that we're talking about, whether it be through vaping or dealing with trauma, it's a real challenge, a real problem. And so it's a part of the larger conversation about health disparities. That's a big one that we kind of need to focus on and hone in. How are we going to address the problem of trauma and this new young people turning to drugs to ease that pain? It's a real challenge.
You know, I think the disconnect, it's just a theory I have, comes from people being wrapped up into their own moments and their own world in terms of um, what other people might be experiencing, because it's you know, a threshold is a word that comes to my mind.
Mm-hmm.
For example, there's someone may try some drugs and then never do it again.
Mm-hmm.
There's some who'll try it, and next thing you know, they're strung out.
Yeah.
And so the same thing is true with other things in life.
Mm-hmm.
Some people have a certain threshold for things, and others may just, one thing that might break someone down and make them quit
Mm-hmm.
is the same thing that'll make another one rise up and um, champion the cause.
Yeah, I have a unique story about that. You know, unfortunately, some of our musicians are not really conscious, aware of the fact, or they don't acknowledge the fact that their influence is really great on young people.
Mm-hmm.
We had some young people go to a concert. I think it was a Snoop Dogg concert,
Mm-hmm.
and they had the. Don't get mad at me. I know you some Snoop fans. They had the Rice Krispie treat
Mm-hmm.
laced with marijuana. They had the gummies laced with marijuana. They had all of this stuff, and these kids were 18, right?
Mm-hmm.
I don't know how they got the stuff, but anyway, they all got sick and had to leave. I know that most of them had to leave. 2 or 3 of them, I think.
Okay.
What I'm saying is that it is challenging when in our own culture there's this promotion of escapism or drugs or getting high, being lit, which is the language that we use. Even it's a metaphor for everything now. Being lit, which comes out of getting high. And I'm not demonizing anything. I'm just saying that this is a real challenge in the community, and we have to keep our eye on that ball, as Dr. Chomilo said.
Yeah.
Because more and more kids are gravitating to, marijuana and the gummies and these kinds of things, and then shooting for the higher drugs. It's a real challenge, and it's promoted in much of the music.
Oh.
It really is. It's
Yeah.
a significant challenge. So.
And I think some of the challenge too is how do we navigate that as parents, as adults in the community, and when I have a teen disclose that when I'm seeing them in clinic, I don't jump to saying, oh, how are you doing that, or that's not great for your health. I ask questions like, well, why did you try that in the first place? More often than not, folks are just curious.
Yeah.
And some of them, like you're noting, have different thresholds. And so I talk to them about the fact that it can sometimes, for some folks, take one time and all of a sudden your brain's sending your signals that I want to do more, I want to do more.
Yeah.
And for other people, they can do it and not feel that, right? And so giving them the context that, because particularly in teenage developing brains, so much of what you think is that everyone's going through the same thing, right? And you want to be like the same like everyone else, but not everyone is, from a kind of developmental perspective, literally going through the same thing. And so it's kind of being able to take that, as a parent of a 7-year-old and a 19-month-old, who they get into some stuff, and like sometimes my initial reaction is like, a little bit of rage or steam out of the ears. I think, and some of that's based off of just disappointment. Some of that's based off of fear. I don't want them to get, hurt themselves. Why are they doing something like that? I think the same, we got to think about how are we engaging youth around this, and making space to kind of listen and understand, and then try to recontextualize for them. And I even, in my conversations, if a teen hasn't used, I've asked, have you thought about what you would say, if you were asked about that? Because if you are more likely to, have thought through why you don't want to use something, why it's not right for you and your plans and what you got going on in your life, then you're not going to get caught off guard as easy, and you're more likely to, make a decision that keeps you healthy. And so, how do we, again, you listen, and then try to give our teens those languages. But then it does, that's not going to solve folks who are experiencing ongoing trauma and ongoing issues that are causing a lot of the pain and hurt that they're trying to hide with these, and then how do we help them with that too?
Mm-hmm.
And on that note, help. As we address the viewers and listeners, Doctor and Reverend, tell us how folks who have not heard of you or any of the stuff you're doing, but they're listening now, how can they help the cause right now? What would you ask them if someone says, tell me something, tell me what to do? How can we help?
Want to start on DHS?
Sure. Yeah. So, from our perspective, we just want to make sure folks get that, at least that baseline coverage, right?
Mm-hmm.
And so I think it's something that, because either it's kind of complicated or not super.
Baseline, you mean MinnesotaCare?
Yeah.
Some up to
Yeah.
Sure and
Exactly.
right.
Exactly. And so, yeah,
And I'm gonna give the website to go to for those who want to log on.
Perfect.
Before we
Perfect.
go.
Yeah.
I'm sorry to interrupt.
Yeah. No. And so it's kind of just knowing, making sure that everyone covered. And if you're on state insurance, know that like once a year, you still have to go through the process of renewal. And if you got questions about that, there's places where you can get help from Navigators. You can talk to your faith leaders, and a lot of them again are working with us, and can know how to connect you there, and then knowing what your what you have a right to when you have state insurance.
Right.
So bill was passed that starting this year, no copays. And so if you're on state insurance, you show up to the doc, you shouldn't be, getting a bill for a copay.
Is that for the working poor, or that's for the folks who are on medical assistance?
Medical assistance, yeah, yep, exactly.
What about the folks who are, I think it's like an income thing?
Correct. Yeah. So MA or medical assistance, there's no copays. MinnesotaCare, which is what folks talk about the working poor. There's a lot of folks in MA who are also working as well. But for those who make it a little too much to qualify for MA, but still qualify for MinnesotaCare, there's generally more like a sliding fee as far as whether you have a copay or not, and what that is and what that looks like. But for our folks on MA, no copays for visits, no copays for medications, consultations, and so wind folks, if you're doing telehealth, you got a lot of options to get care that we'll hope you're aware of. There's services like Doulas services. There's benefits for community health workers to help, and so looking for systems that offer those type of care and services that are covered as well.
Let me just explain for the folks in the cheap seats. The doula services is like a midwife, right?
No. So midwives are like clinicians that can train you through birth. Doulas are trained to help as a support through all of pregnancy and afterwards, as well as the birthing experience. So
more than a midwife, but almost.
So I that more and less is what I tend to try to stay out of. It gets me in trouble in this particular situation. But midwives,
somebody listening, was going to say, what is that?
Yeah, midwives are trained more like OBGYNs or clinicians. Okay. You often folks talk about nurse midwives to kind of help contextualize that. So they, if you have an uncomplicated pregnancy, they can help you labor in a lot of different situations and take care of you and your baby. Doulas are kind of supports, and they provide supports for you and your spouse or your family. They often provide culturally specific supports, right, which are real important, particularly as we know going through the birth process and how our healthcare system treats our women and birthing persons. It can be challenging, and so having a doula has been shown to help improve your outcomes as well as having your care delivered by a midwife.
That's good to know. In fact, that sounds like a workshop waiting to happen. Just that alone.
I know some people. We can make that happen.
And in fact, I was just
and we provide the space.
Yes, exactly.
Right into the community.
Well, you know what? That I should have you talk to the boss lady here. The president was talking about the spokesman sponsoring a health fair.
That would be great. We'd love to be partners on that.
And she should be still in the building before you leave. I'll let you just chat with her.
All right.
Connect.
Yeah.
So, but yeah, we we've had a real good conversation.
And I would just add two
with
cents from the church side. I would just say that, I'm the pastor of Progressive Baptist Church, and I said we work with a network of churches in any individual in the community. We have navigators and individuals who can connect you with, help you to get the resources that you need to make it more accessible. And we're right there in the community. You ought to be a member of the church. We want to just say that we're making ourselves available to the community.
Did they up the pay? I mean, not the pay, but did they the budget increase the budget for hiring more navigators as of the last 2 years or a year or so because of the
So the state doesn't hire navigators directly, but they do pay money in a couple different ways. One is, paying navigators for each person that they help get through the process, and then one is just a general kind of grant that they offer.
Mhm.
And so in both cases, yes, there has been increased funding, but I think there's still more work that needs to be done there as far as increasing both funding and supports for our navigators.
okay.
And let me say that we also have, in conjunction with DHS, all the other things we talked about, addressing the social determinants of health, working with the Dream Project and others who are helping young men get back to work. We work with the unions, the trade unions, and we got 85 guys back to work who had barriers, felonies, and what have you. And so those pieces are also part of the network. So we're as we talked about earlier, sometimes it's complex.
Because it's stressful to be unemployed, and that can affect your health.
Yeah, right.
Break everything down. So it is all related as far as I'm concerned.
And that's the type of partnerships we're really excited about continuing to expand because, people don't come in kind of just one. It's not just their healthcare needs. It's not just their housing. It's not just their food. It's not just their jobs. And we know all those things contributes to health. And our mission is to improve the health and well-being of our fellow Minnesotans. So we're happy to have these partners. Yeah.
Awesome.
Oh, yeah. And who are some of the other partners that are out there that we don't have here today that you like to shout out?
Yeah, so Imam El Amin and his organization have been really great partners as well. We actually worked with about 20 different what we called micro grantees because they were small grants, roughly like 5,000 or so, that went out to support this type of work, and we were able to secure some funding to expand that. And so we just finished our initial call for larger grants to support this work in a more ongoing way going forward. But lots of great organizations that I think one thing of note, some of them it's their first time working with DHS like this, and so we really try to honor that and understand what it's like working with smaller organizations closer to the community and what we can learn from them and help them through that process too. So more great work to come, hopefully down the road.
Okay. And I mentioned I mentioned the St. Paul Black Interdenominational Minister Alliance, the St. Paul Black Church Collaborative, and Pastor Webb and the Dream Project. So a number of partners.
Oh, great. Yeah. So is there, with this, I'll call amalgamation, is there a website specifically for you guys for that partnership? And if not, maybe there should be.
They're working on it.
Yeah, so there's no specific one for this part of the partnership. If you go to the Renew My Coverage, DHS.gov.
That is mn.gov/DHS/renew my coverage.
Yes, so there you can find information on going through the renewal process, as well as there's a community engagement hub. And so if you're interested in where there might be events going on near you, if you are part of an organization that's interested in getting involved, ways to contact us, let us know that you're holding an event, interested in learning more. So if you go to that Renew My Coverage website, there's a community engagement hub, and check us out there.
And then there's the website for folks who want to sign up for MNsure, www.mnsure.org. And with that, gentlemen, we could probably talk all week and come up with a whole bunch of stuff.
Solve all the world's problems, right?
There you go.
Hey, look, saving the world. You know what? When you save the world, you can't collect unemployment because it's too much work.
Exactly.
And on that note, I want to thank you guys for coming to share with the listening and viewing audience the information that you had about we're in a serious crisis. You know, we had a good conversation, but disparities. We're on the highest on the disparity wheel. If you spin it, you'll find that many of the folks that our target listeners can relate to those numbers. And we thank you for the work you're doing and trying to reduce those disparities and get the information out. So
Yeah, let's end on a note of hope in that, we looked at the data as far as how when folks go through our process, how likely they were to lose their Medicaid coverage. And, this time last year, Black and American Indian and Hispanic enrollees were more likely to lose their coverage going through our process. But we have been working diligently over the last year. And when we looked at the data this June, we saw disparities for Black and American Indian members disappear and greatly reduced for her Hispanic members. So it's working, listening to their communities, working together. We're keeping folks connected to healthcare. We hope that when we look at our health data in 2-3 years, that we see the results of the health impact of staying connected to insurance. And so I think there's some good news on the horizon, and really glad to be here today to spread it.
I'm inspired, and I am grateful for your presence and your hard work. On that note, on behalf of Reverend Miller and Dr. Chomilo, I'm James Stroud, and I want to thank you for tuning in and listening. This has been the MSR Medical Podcast. Good night.